Good afternoon. My name is Jen Saunders. I'm a Senior Program Officer with the National Alliance to End Homelessness. I would like to welcome you to our webinar series on rapid rehousing. We are so delighted today to have our speakers talking about how Cleveland is addressing family homelessness. Our agenda today for the webinar, we will have presentations by Angeline Sulak from Frontline Services, Lehman Busby from Cleveland Mediation Center, Jen Federer from Eden, and Ann Denenstedt. My apologies for the for the incorrect thing of the names, and we will be followed by a Q&A. I will give a very brief overview of rapid rehousing, as I know most of you are familiar with the intervention. Rapid rehousing is an intervention designed to help individuals and families quickly exit homelessness and return to permanent housing. It's offered without preconditions, and the resources and services provided are typically tailored to the unique needs of the household. The core components of rapid rehousing include housing identification, rent and move-in assistance, and case management and services. While a rapid rehousing program must have all three core components available, it is not required that a single program provide all three services, nor that a household utilize all of them. It's also important to take a broader view and look at how rapid rehousing can transform a homeless system. By reducing wait lists for shelter and capacity demand. And the role of transitional housing in a homeless system is also shifting. And we will hear some of that today, but we've also had several rapid rehousing webinars in the past that cover that topic. And as I've mentioned, we had webinars in the past few months. They're all posted on our website. I will, at the end of the webinar, talk about a few that are upcoming this month and next month. So we hope you'll be able to join for those. And with that, I will turn it over to Angeline.
Good afternoon, everyone. Like Jen said, my name is Angeline Sulak, and I work at Frontline Service in Cleveland, Ohio. And I'm just going to be talking about an overview of coordinated intake and progressive engagement. Next slide, please. Next slide. Okay, so just to go over just a very quick overview agenda. Again, I'm going to talk a little bit about Cleveland, what we do locally, coordinated intake, diversion, progressive engagement, our process of how we house families, and then we're just going to talk a little bit about challenging families, and then obviously we'll have time for questions and comments. Next slide. Okay, so just a little bit of an overview of Cleveland, Ohio. In 2015, we had 2,922 singles who were newly homeless and 374 families. Our point in time count in 2013 was 2,052 sheltered, which means that they were physically living in a shelter, and then 77 unsheltered, which means that they were living on the streets or in an abandoned building, something like that. So as you can see, in 2014, our numbers jumped a little bit higher for the sheltered folks at 2,075, but lower for the unsheltered folks. Also in 2015, we did a little over 6,000 intakes through coordinated intake where we are. So just some things about Cleveland. You know, the definition between literally homeless versus doubled up, we use the HUD definition of literally homeless, which basically means that we work with folks who are physically living on the street or in a shelter, as opposed to, you know, another homeless definition which is considered doubled up, such as, you know, they're staying with mom, but they want their own place, or they're sleeping on somebody's couch temporarily, things like that. Another thing about Cleveland is that it's guaranteed shelter. So 24 hours a day, 7 days a week, singles and families can access the shelter system. And so we're one of the only counties that actually offer this. So we think that that's pretty great to share. And then also our housing first approach. Like most other communities, we use this evidence-based model that states that we need to end someone's homelessness as quick as possible. And we do this by providing permanent housing or an exit plan. Furthermore, we believe that people's basic needs are met first, such as housing, then they are more successful at addressing other issues such as drug and alcohol issues or mental health, medication compliancy, things like that. And then the last thing I just want to note is that we started doing progressive engagement, which is another evidence-based practice where we try to match the right intervention at the right level based on someone's housing barriers. And so we started this last year, and we've been doing it for over a year, and our return to homelessness has decreased, and we'll be getting into that a little bit later. Next slide. Okay, so why coordinated intake? A couple of the main reasons is we want to serve everyone. Everybody that walks in the door, we want to be able to serve them. We do not turn anybody away, and we help everyone that comes through the door, whether that's questions or, questions about housing, or they need to get into the shelter system. We think it's really important to have one access point to sort of coordinate, services and different placements in order to best serve homeless folks. Obviously, we care about getting the right intervention at the right level to the right person, as we call that progressive engagement. And then, the other thing is we really want to end someone's homeless episode as quick as possible, and hopefully they will not return to, they won't return to being homeless. Next slide. So just going into that, these are just some goals that we've established for coordinated intake. And, the two most important goals, again, are to reduce the number of individuals and families that actually enter the shelter system. And then the people that enter the shelter system is really to expedite their exit out of shelter. We really want to make sure that that's as short as possible. The other thing that I want to point out is that we use HMIS, which is the Homeless Management Information System, and that's a standardized data entry for tracking and reporting and coordination services. And so everybody in our continuum uses this data tracking method, and it's been really successful because it's an open system. We can view clients, the other shelters and the other providers can look at clients, and we think it's really important for that coordination of care. Next slide. So a little bit about our background. Before we started this in 2010, our old system, was 20 plus shelters. They were all working independently. Everybody had their own intake process and how to get into a shelter. And, we formalized coordinated intake in 2012 with adding the family shelter providers on board. And it's been really great because, like I mentioned earlier, we all sort of now use this HMIS standard intake. Everybody is getting into the shelter system that actually needs shelter, and it's really sort of helping us serve the truly homeless people that need to enter the shelter. The other people are being diverted, and I'll let Layman explain that after this. So it's really sort of just, coordinating everything into one access point. We are located downtown, right by the bus line, and in a very neutral location for folks to find us. We're open Monday through Friday, and we have an on-call system for families on the weekend to make sure that if they need shelter, then they can access that. And we contract with our COC, which is Cuyahoga County, and we're also HUD mandated. Next slide. Okay, so how does this work? It's basically broken down into 5 steps, which is intake and assessment, diversion, housing plan, linkage to shelter and crisis services, and then coordinated exit. Next slide. So intake and assessment, basically what this is our HMIS system. We use Service Point locally, and we collect these data points so everybody can get into the system. And basically it's demographic information, and with the client's permission, we can share it with the providers. We really focus on the second piece, which is this assessment piece, and we go over a housing barrier assessment. Next slide. And this is an example of what our housing barrier assessment looks in Cleveland. And it basically sort of gives us a score, which again is just used as a guide. And it goes over what are the housing barriers? You know, what kind of income do they have, their work history, their mental health, you know, prior evictions, how many children they have, things like that. And so we do this on every single person that walks in the door, and the person gets a score. And that just sort of guides us into what level of intervention or exit plan that they're going to need. Because we're always thinking about, again, how to get them out of shelter as quickly as possible. And so this score helps us sort of determine, well, this family or this single might need, you know, another level of an intervention when we're developing that housing plan. The other thing I want to mention for when we do our assessment is we screen for crisis. It's a huge part of what we do every day. And so when people come in, oftentimes they're in crisis. And so we are making sure that we're screening for suicide or doing a risk assessment, mental health, domestic violence, sex trafficking, work trafficking, sort of all those things, because since we are a central access point, we want to make sure that we're not only for, you know, intake and shelter, but also that access point for any sort of crisis, you know, intervention that we might need. Next slide. And so the second part of coordinated intake is this diversion part, and I'm going to hand it over to my colleague, Layman Busby from the Cleveland Mediation Center.
Hello, this afternoon. My name's Layman Busby. I'm with Cleveland Mediation Center, and I've been a part of the coordinated intake process since 2010. I manage diversion activities along with a team of diversion advocates that are trained in transformative mediation. Now, what is diversion? Diversion activities aim to help persons who are experiencing crisis explore options to prevent or reduce shelter stay. Now, these could be temporary or permanent solutions. Now, we don't lead the persons toward those options. They'll chart a course of their own. We'll follow their lead, and we'll provide, excuse me, a minimum amount of assistance to help them to get housed. Diversion is considered a prevention strategy. It should always be safe and appropriate for persons involved. And what I'd like to do is share a short diversion case as an example of CMC's work. Slide 2, please. Now, this case is about a gentleman named Al. Al's a husband, a father of 2 preschool-aged girls, and Al's wife, Ann, suffers with mental illness that was typically manageable with medication, but terribly disabling for her without the meds. Now, unfortunately, the meds made her so drowsy that she struggled to provide the necessary care for her daughters. But Ann's mother was the family support system. She didn't live in a home, but she helped Ann care for the children, and she generally helped assist their daily lives. Now, Ann received SSI income, and that's how her and Al maintained. So now after initial contact with Al, I began to consider just the types of diversion that might be appropriate for this type of case. Now, Al, in this particular case, could have decided, as it were, to return back to the home. He could have considered his own place, and we could apply some assistance. We could do a mediation, a family conference, an over-the-phone mediation if sending him out of town was part of his plan to live with other family members. But Al decided that what he wanted to do was to gain full custody of his daughters and to get a place of his own. Next slide, please. So naturally, I double back and I begin to probe with Al for details in an effort to help Al to really think through the efficacy of this plan and what might need to happen in order to execute it. So what we utilize, as I mentioned, is conflict coaching and as well as transformative mediation techniques. And through that, what I learned is that Ann, Al's wife, her mom had 6 months prior to him coming into shelter, she had passed away. So this family lost a major support network, a major support part of the support system. And so Al reported to shelter, and this now represented a catastrophic event or set of events that really upended this family's life. At that point, when after mom had passed shortly after, Ann stopped taking her medications. She wanted to be more coherent so she could provide, obviously, the care that her children would need. But neither she nor Al were fully aware of the seriousness of her mental health. And once she stopped taking her meds, really all heck sort of broke loose. What Al described is she became like two totally different people. He described that she began to frequent bars, use recreational drugs, which she hadn't in the past, generally became negligent and sort of abusive towards the children, and she even began to see other men. Now for Al, as he explained, the turning point for him was one evening she returned home after being out, and she brought another gentleman back to the house. Well, this led to a physical altercation between the two men. Al was jailed for a short time, and when he was released, he was legally unable to return to the home. So Al began to access what we described as a doubled up situation. He stayed with friends and acquaintances for short times and short stints, but these arrangements ultimately became untenable, and now Al obviously needed to come to shelter. And so in Al's absence, as it were, from the home, the school and the daycare had begun to notice, I should say the administrators there had begun to notice that the level of care and just the general upkeep of the children had downgraded. And there were some things that had occurred very inappropriately and behaviors exhibited by mom that they became increasingly concerned and notified DCFS. Over time, ultimately, DCFS removed the children from the home. And so now Al's plan began to sort of mainly take shape, and I began to think about how can I help him to execute what was for him the best plan. You know, and I thought this obviously was going to require some major coordinated effort to assist this family. So in thinking about what our local organizations are, we accessed for him legal aid services, and that was to help him out with the custody issues. He was going to be dealing with the guardian ad litem and many other legal constraints that were on him. The courts were requiring him to have a 2-bedroom house, or 2-bedroom unit, I should say. Well, Eden Incorporated, our housing partner, assisted us in locating an affordable 2-bedroom place so that he could meet that mandate. Next, and obviously he had to obtain gainful employment. We referred him to Employment Connection, another community partner, to where he was able to be trained, and they helped him to find gainful employment. Next slide, please. And so with respect to this entire case, I want to mention that Ann, during this period of time, was getting the help, started going back and getting the help that she needed. And she actually at a point began to support and assist Al in gaining custody of their children, regaining custody of their children. And so what I want to illustrate here is that ultimately Al was granted custody of the children. And he and Ann are managing with trying to raise their children and do what they need to do. They were able to avoid extended stays in shelter. They were able to get back to self-sufficiency. And what I think this case really illustrates further is that it demonstrates, one, 3 main features that distinguishes Cleveland Mediation's unique approach to diversion. One, that we use transformative mediation techniques. 2, that we try to creatively use financial as well as non-financial assistance. And we apply the least amount of assistance in every case to try to assist people with reconnecting with housing. And third, it's our method of sort of progressively, being involved with families involves a lighter and lighter touch over time, where we have less contact as folks begin to move towards self-sufficiency. Now, again, with this case, it also illustrates how coordinated intake, diversion, progressive engagement via case management can assist families and individuals, particularly when those families are persistent and they really want to be self-sufficient. So what I'll do now is I'll turn over to Jen Blighter. I apologize. Angie's going to pick up some more information from here.
Next slide, please. So like Lyman mentioned, you know, if somebody is not diverted, then they come back. They don't physically come back because we're all in the same location, but they see our staff again, and we start working on a housing plan. And so our housing plan basically consists of 3 different plans. The first one is the short-term plan. Where are they going to stay tonight, right, which is the most important of where they're going to go. And then it also goes over an interim plan, like a temporary plan of where they're going to stay until their permanent housing plan can be established. So this could be a transitional housing or a treatment, you know, something like that. And then obviously we talk about the exit plan or the permanent placement. And so the housing plan travels or goes with each client to wherever they end up as sort of a guide for the case management staff at the shelter. So they already know sort of where they're going and what plan that they need to work on with that specific client. And so, you know, a lot of what we do, again, is based on using that housing barrier guide and obviously our local resources and, you know, getting the right intervention at the right level according to the housing barriers. And so low to moderate barriers, you know, obviously we do rapid rehousing for families. Higher barriers go to transition in place for families. And then very high barriers are, you know, they're going to get that level of assistance, which is a permanent supportive housing voucher, like a shelter plus care voucher, or they're going to get bridged to CMHA public housing. Next slide. So this is kind of an overview of what progressive engagement looks like for families in Cleveland. And so as you can see, all of our families get referred to rapid rehousing, which is a 4-month rental subsidy and security deposit attached with case management. And since August 2014, we processed 400 families in rapid rehousing. So some of those families, as you can see, no additional assistance is required. If you look at the left arrow, you know, those families, they get that assistance and they're fine and they're stably housed and they don't return to homelessness. If you go down the middle arrow, you can see some families need more assistance. And what we call that is the Zacchaeus housing. That is 6 months of additional rental assistance and intensive case management. The case management model that is used for these families is the critical time intervention model, which is another evidence-based practice of case management. And out of those 400 families that were processed, about 25 to 30% of the rapid rehousing families get referred to this second or this additional level of assistance. And then from there, some of those families are fine, right? They get a little bit of extra assistance and they are fine and there's no additional sort of, you know, housing assistance required and they're successfully housed. If you continue going down the last arrow in the middle, some of the Zacchaeus families still need an additional level of assistance, and this is the 3rd tier of assistance, and that is a permanent voucher. About 50 to 60% of the families that are in the Zacchaeus housing actually get bridged to a shelter plus care voucher in our community. And, you know, one of the reasons for that is because, you know, as the need is higher, obviously their housing barriers are significantly high if they're going to need a voucher. And so people that we put in Zacchaeus, oftentimes we know that they have, you know, substantial mental health or, you know, drug or alcohol issues, or, you know, they just need that additional level of assistance. And so we put them in Zacchaeus ultimately to bridge them to a permanent voucher. Recently, what we also started is bridging people from that Zacchaeus, so that second level, so that second tier, to public housing. So we've partnered with our local public housing agency, and some of the families that are not mentally ill but really need that 3rd tier of assistance, so these are young families or families who really don't, haven't had a lot of sort of independent living skills, things like that, they're actually going to get bridged to public housing. And we just started that this year, and we're anticipating that about 50 to 60 households will be bridged to our public housing agency in 2016. The only other thing I want to mention is that sometimes families, we do have turnaround, and so families that are not successfully housed will come back through our doors. If a family has already been through rapid rehousing once or twice, obviously we're going to try a different housing plan. And so that third arrow kind of on the right side, some families that we know that have a persistent or severe mental health diagnosis, and we know that they're not going to be able to sustain, we have in few cases bridged them directly to that voucher because we know that that's exactly what they need. Next slide. So I'm really not going to get into rapid rehousing. I'm going to let Ann and Jen do that. This is just an overview of exactly what it looks like, which I've kind of already talked about, and Ann and Jen are both going to go into it more. So I'm not gonna really talk about that. Next slide. And on this slide, I just kind of we talked a little bit about Zacchaeus, and we talked a little bit about what that Eden voucher is, and I just kind of want to pay attention to our other housing options on the bottom. Thank you. And so on the family side, we only have one transitional program for families, and that's at Laura's Home, which is basically a one-year program where families can stay and sort of work on, employment options and things like that. So, so sometimes we refer families to that because we think that would be a better fit than sort of going through rapid rehousing and sort of progressive engagement. Maggie's Place is it's another transitional program that takes in pregnant young women. And so sometimes if we have a pregnant female, we will refer her to that. And then there's HM Life, which is another transitional program in one of our suburbs that focuses on employment, and I believe that's a 2-year program. And then again, we obviously are always recommending that our families sign up for our public housing because we think that's really important, and that's an affordable option for a lot of our families, which are low income. Okay, so now I'm going to turn it over to Jen, and she's going to talk more in-depthly about our rapid rehousing program.
Yes, thank you. My name is Jen Slider. I'm going to give kind of an overview of our rapid rehousing program in our agency. Eden is a nonprofit housing organization, so our role here is administering ESG, and we also administer the permanent vouchers that some of our families end up accessing, and we also employ the housing locators for rapid rehousing. So the process of a family accessing rapid rehousing begins with families not being able to be diverted. So if they're unable to be diverted from CMC, they're going to enter one of our 7 local family shelters. At that point, the shelter case manager is going to refer those families to Eden for rapid rehousing. So pretty much every family is referred directly to Eden for this 4 months of assistance. At that point, we determine if the family is eligible for the assistance, and we assign them to one of our 2 housing locators. The housing locators then meet with the family, fill out a small application, and kind of just discuss what they're looking for housing. What barriers they may have, such as past evictions or a criminal history, and if they have any balances on their utilities that may limit where they're able to reside. So once they get that information, they can start sending the family some housing leads. So they'll send leads to the family as well as their shelter case manager, so everyone is kind of aware of what the available properties are that might match this family's needs. And all of those leads are documented, so later on we can go back and make sure that we're not duplicating our leads that are assigned, and keep track of how many leads each family has gotten. We also have weekly meetings between the housing locators and our shelter case managers. So everyone gets together once a week, and we go through every single client and talk about where they're at in the housing location process, and at that point kind of discuss any updates that haven't been communicated. Once a unit is located, our housing locators will inspect the units. All of our housing locators are HQS certified. That's Housing Quality Standards So they go through a training so they know what to look for when inspecting a unit. So we know that our families are moving into units that are safe for them. Once the unit passes inspection and the family moves in, the client's assigned to a rapid rehousing case manager, and they'll work for them for the following 4 months. And our rapid rehousing case managers are employed by a separate partner agency. Those staff are not employed by Eden. Next slide, please. So in order for our housing locators to have leads to refer our families to, we have to develop some strong relationships with the landlords in our community. So one way that we do that is our landlord forums. So we have monthly landlord forums where we invite landlords to come to our offices, and we have a PowerPoint slideshow and kind of go over the paperwork that's required for the landlord to receive a subsidy and what the time frames are for us processing, inspecting, determining the rent, so they understand exactly what the process is and what they can expect. We ask new landlords that may not be familiar with us to attend those forums, so they have a name and a face that they can recognize if they have questions in the future. They know of a point person that they can reach out to. We also use a lot of referrals from our current landlords. So when we're out doing inspections, we'll ask landlords if they know of anyone else who has available property that we might not be aware of that might be willing to use our subsidy program. So in that way, we garner a lot of new referrals through our landlords that we currently have and accessing their networks. We also have existing landlord base from our permanent program. So like I said before, we administer permanent rental subsidy programs, and we have over 2,000 landlords that we've worked with currently or in the past that we can reach out to. And if they've already worked with us for a permanent program, sometimes they're more likely to accept a rapid rehousing client who just has temporary assistance because they already are aware of our process. And that we make the on-time payments, which is really important to our landlords, is making sure that they get that money on the first of the month every month, and is one of the advantages of having a subsidy client in their properties. And we also try and explain the advantages to our landlords of renting to a subsidy client. So really pushing that case management, that each of our families is going to have someone that's working with the family regularly, coming out to their unit. That can really help entice the landlord to rent to one of our clients if they know that they're going to have that follow-up. We also talk to them about helping a family and helping our community by housing these families, and sometimes we can recruit landlords through that avenue. And we also explain to them our goal of having no eviction. So just really explaining to them that our goal here is to house someone permanently and make sure that they are living in that unit throughout at least their total lease. Next slide. So we use this progressive engagement model for all of our families that are entering shelters. So many of our families have some significant barriers, as I'm sure many other agencies out there have as well. So I'm not going to go through each of these, but just want to kind of highlight that we have a lot of families with some serious barriers, some really large families. We've served families in the past with up to 9 children. We have families that have vast utility balances that can't get into certain units because they only have certain utility companies at that unit. We do house clients with 0 income, so we will work with someone who comes into shelter with no income to start with. Also, something that we've been coming up against more recently is language barriers. So we have families coming in that may speak only Spanish. So trying to communicate to them the housing leads and what the process of the subsidy is can be challenging. But ultimately, we try and house them with a Spanish-speaking landlord so they can communicate with each other properly. Next slide. So some of the strategies that we use to overcome these barriers are, number one, just knowing our landlord pool. So knowing the landlords that have units available and knowing who they'll accept and who they will not. Recognizing who's going to do a criminal background check, who's going to check for credit, and then if we know someone has a felony in their background, not even referring those families to the landlord. We don't want to waste any time. We want to make this process as quick and as smooth as possible. So knowing a lot about your landlords and who they're willing to accept and who they're not willing to accept is really important in this process. We also use other resources in our community, such as PRC and the Furniture Bank. So PRC we use at times to pay back balances on utility bills. So if someone has a large balance on their electric bill, but they have to pay electric in their new unit, we'll access PRC funds at times to help with that. And then we have a local furniture bank that we access furniture for our families from. Our shelter milestones are something that we've implemented last year, and those are just objectives for our shelter case managers to complete with a family while they're in shelter to get them ready for housing. So this has really created a lot of consistency across the board in our shelters, and it's really allowing the families to get ready for housing while they're still in shelter. And Anne's going to go over those milestones in the next slide. And the final strategy that we use is case management milestones. So those are objectives for our rapid rehousing case managers to complete with a family while they're in their first 4 months of rapid rehousing. And that's to help them gain self-sufficiency before their assistance ends. And Ann is also going to go over those as well. Next slide.
Hi, I'm Ann. Excuse me. Hi, I'm Ann Denstead with Eden. I supervise the rapid rehousing program in the housing locator. So working collaboratively is a necessary part of our progressive engagement model. To help facilitate the collaboration, the milestones were developed at both the shelter and the housing levels. The milestones help to focus services provided to families towards locating, securing, and maintaining housing. It helps to reinforce the housing first approach and has standardized services among the different shelters in our continuum and our partner rapid rehousing case management providers. So let's talk a little bit about the partnership at the shelter level. The ultimate goal of the shelter milestones is to assist and prepare the families to rapidly exit shelter by working to address barriers in preparation for maintaining permanent housing. So the shelters will refer families to rapid rehousing within 7 days of their admission to the shelter. During the time that the families are searching for housing, the shelter case managers are assisting the families with addressing their needs and barriers. So those include income efforts, income and employment efforts, such as linking them to local employment assistance programs, applying for county cash benefits, or disability benefits such as SSI or SSDI. Along with that, they help to coordinate with the housing locator, which includes assistance with facilitating appointments, following up with the families regarding what housing needs to make sure, did you call the landlord, did you go see the unit, things such as that. In preparation for housing, the shelter case managers also help to determine the status of utility. So if there's a past due balance, they're providing info regarding utility assistance and resources. In addition, they discuss with the families if they have all their requiring documents for each household member, because oftentimes that's needed with rental applications, but also with utility assistance. And then they'll work to refer them on for or give them resources to obtain those missing documents. They also assist with developing a plan for furniture. So this may include the shelter agency's resources, or referral to our local furniture bank, applying for PRC, or if there's an open case with the Department of Child and Family Services, coordinating assistance with beds or other household needs with their assigned caseworker. So in addition, the shelter case managers communicate and coordinate any shelter discharges with central intake. They also attend the weekly meeting with the housing locators as well, so where they discuss families' progress towards locating housing and assist with the coordination of families moving out of shelter. So we've moved to kind of a 72-hour turnaround time. So to help expedite families move to housing and efficiently manage our shelter openings, the shelter staff work to ensure the families move out of shelter within 48 hours of their unit passing inspection. They then clean and prepare the open shelter space within 24 hours, thus allowing for a new family to admit to shelter within 72 hours of the previous family's unit passing inspection. This has helped to better kind of manage our use of overflow shelter space in our continuum. Next slide. So an essential part of the partnership at the shelter level is the collaboration of services among providers regarding non-compliant and challenging families. So some of the issues that we often encounter with families are a failure to locate housing by their 30-day deadline, families that struggle to comply with shelter expectations or who cannot function in the shelter environment, or negative shelter discharges. So to help address these issues, the shelter staff, rapid rehousing staff, and central intake staff will collaborate and schedule a mediation in which they'll develop a behavioral contractor plan to avoid clients being discharged before locating securing permanent housing. The mediations and developed contracts or plans help to reinforce not only the families but also the providers, and has proven to be a successful way in which we can motivate all of us who are involved so that the family locates and secures permanent housing. Next slide. So once the families have located housing and their unit has passed an H-group-S inspection, the families will move into housing and begin working with an assigned rapid housing case manager. Again, the milestones help to standardize services and focus rapid housing case management providers and the families towards maintaining permanent housing. The families and the rapid housing case managers are required to meet at least one time per week. During these meetings, they complete housing stability plans and reviews and work towards goals for maintaining permanent housing. The rapid rehousing case managers will submit case management documentation, which documents the ongoing case management services, their progress with goals, and allows for rental assistance payments to be sent on their behalf, of the clients to their landlords. So at the initial appointment with the families, the rapid rehousing case manager they'll review the lease, provide education regarding landlord and tenant rights and responsibilities. The rapid housing case manager is also available during those 4 months that they are working with families to address any tenancy issues that may arise with the family and the landlord. So the rapid housing case managers resume the work that was progressing in shelter. So they will link the families to child care assistance if that's not already in place. They'll continue with the employment search or income efforts such as providing leads, resume development and education, and additional community employment assistance resources. As support is important to enable a family to maintain housing, rapid housing case managers will link the family to community support resources, and these include such mental health treatment, case management, neighborhood collaboratives, local food pantries, and other community case management support. Since we strive for the goal of no evictions, rapid housing case managers are working to develop an eviction prevention plan with families. This may include discussing how to pay rent, when to pay rent, providing money management education, and assist with the development of a budget and savings plan. For families with high needs and barriers, they may refer for additional assistance and more intensive case management services. Or they may develop another plan for housing, such as applying for subsidized housing, discuss residing with family members or friends, dependent on their circumstances. So to continue to ensure collaboration, the rapid housing case managers meet twice per month. During the meeting, we discuss each family and their progress towards milestones in maintaining housing. We also discuss challenging families, which helps facilitate a conversation to problem solve. Next slide. So during the time the families are working with their rapid housing case manager, they are continually assessed on their ability to maintain housing. With the progressive engagement model, all families are going through rapid rehousing first. So towards the end of their third and fourth, maybe beginning of their fourth month, the rapid rehousing case managers have a pretty good idea as to whether the family will be able to maintain housing. There's now the option of referring on for additional assistance, additional rental assistance, more intensive case management services for those families that have been identified as having really, high barriers for high needs. So the Zacchaeus Housing Solutions Program will provide the family with an additional 6 months of rental assistance along with intensive supportive case management. So when we're trying to determine which families are in need of assistance, there's several factors that are taken into account. We discussed, were there previously failed rapid rehousing enrollments? Are they chronically homeless? The current barriers of the family and what the updated housing barrier score is. What the family's ability is to pay rent. Do they have income, no income, pending, cash or income benefits such as SSI or SSDI? And discuss the long-term needs of the family. Will the family possibly only need additional temporary assistance, or is this a family that may need permanent assistance such as a permanent housing voucher for families with significant mental health and/or AOD, or for families with low income, minimal ability to increase their income, such as somebody who just has, a set income of SSI or SSDI. Are they, possibly somebody who eventually may need to go through and apply for subsidized housing with CMHA. So it's also important to determine how compliant the family has been with case management and progress towards milestones. So if they, really weren't engaged with their case manager or didn't really follow up, this is also taken into account. And finally, it's also the timeline as to when they would need to transition to an additional assistance program. So when is their 4th month of assistance, and are there openings for that? Do we need to try to maybe possibly extend for a 5th month, which we've done in more extreme cases? Next slide, please. So the old process versus the new. So how have things changed with the progressive engagement model? So previously, rapid rehousing was initially a security deposit and 2 months of rental assistance. If needed, the family could receive extensions up to 6 months. But after 6 months, the family was responsible to pay rent. There was not an option to bridge to another program for additional assistance. So we assessed for longer term, or permanent assistance for families at the shelter level, which also included looking at how many times the family returned to shelter. So the new process with the progressive engagement model, all families initially are going through rapid rehousing, and they're continually assessed on their needs, barriers, and their ability to maintain housing. This helps to screen which families are the higher needs and which need additional assistance. Also, the program focuses on a no eviction policy, ultimately striving to keep families in housing and reducing the number of families that return to shelter. So, and as we know, not every family is unique, so the continual assessment and the option to allow families to bridge or change programs allows families to remain in housing and receive additional services that they need. Next slide. So you may be asking, all this sounds great, but has the progressive engagement model been successful? And yes, so far we've seen positive outcomes since implementing progressive engagement. We've reduced the time frame from enrollment to when the family is housed. It was previously 60 days. It is now on an average of 42. Also, we've seen a reduction in the number of families that have returned to shelter. It was previously 23%. It is now down to 17%. So when looking at families that have bridged and received additional assistance, of the families that bridged to the Zacchaeus Housing Solutions program, only one of those families has returned to shelter. And of the families that bridged to a permanent voucher, 0 families have returned to shelter. So the continuum has improved to manage shelter space and reduce the use of shelter overflow with the 72-hour turnaround of families moving out and new families moving in. And the progressive model with the milestones has helped to standardize the services the families receive both in shelter and in housing, and has improved the collaboration amongst the different providers in our continuum of care. So as you can go to the next slide. So as you see, although nothing is perfect, and we've definitely had some bumps along the way, overall the implementation of the progressive engagement model has shown positive outcomes on many levels for us. So thank you for joining us today. I believe we'll be taking questions. Thanks.
Great. Thank you so much for your presentations. We do have a few minutes for questions, and some of the questions have been already posed. If you have other questions, please feel free to send them in through the questions box. The first question is, what entity houses your coordinated assessment program, and how is this funded?
I'm sorry, can you say that again?
I'm sorry. What entity houses your coordinated assessment, and how is it funded?
So the agency that I work for is Frontline Service, and we are the ones who have contracted with the county through the ESG funding. And so they have given us the grant to sort of allow us to do the coordinated entry and exit portion of the ESG. Does that make sense?
Sounds good. Thank you very much. Another question. When you say all families are referred to rapid rehousing, does this mean that you have enough resources to provide rapid rehousing for all families in your pool?
At this point, that's something that we have to really closely monitor, though. You know, we have only a certain amount of case managers that the families can be matched with, and only a certain amount of funds that we have for a year. So far, we've been able to coordinate those and match those up. So anyone who's entering shelter, and there's only so many shelter spots anyway, so if a family may not necessarily use rapid rehousing, they could exit shelter in another way, but the goal is for everyone to be referred to rapid rehousing. So far we haven't had a problem with that, but something we really monitor closely every month.
And the diversion efforts that Central Intake has to identify those who are literally homeless, who absolutely need shelter, kind of help to manage those numbers. So the referrals are only accepted for families that are currently homeless and in shelter.
Thank you. So related to diversion and prevention, can you describe how many people go through this process and what the budget looks like and how many case managers are involved?
Well, as it relates to diversion, case managers don't get involved at that level initially. So what we're trying to do at that point is, after the actual intake assessment, what Frontline Services does is, through the barrier screen, just determine which families or individuals would have the lowest barriers, as it were, and would obviously have the most likelihood of diversion and diversion options. What we had done at a point is going to a system of sort of rating people as, you know, as priority A, priority B, and C, and we would see families based on that priority level. And again, that priority level was sort of looked at through the barrier screen to consider, you know, where folks were before they actually came to shelter, if they had you know, permanent and, you know, housing at a point before, if they have income. So different you know, different circumstances with respect to the family or the individual would determine whether or not they were be referred for diversion, or whether or not they would need more intensive interventions to assist them in that process. And generally, we've been able to basically manage that process that way. In terms of funding, again, through the Office of Homeless Services, we, you know, receive a portion of funds to help folks to access other housing options, and that's how we're funded.
Great, thank you. Under the Zacchaeus model, where did the additional 6 months subsidy in terms of funding? How is that funded?
I believe it's actually still funded through the COC portion of the ESG.
They used to be a transitional shelter, and I believe they reallocated some money towards rapid rehousing in the last round of applications maybe 2 years ago. So that's where that funding comes from.
Thank you. Can you talk about how your coordinated access addresses the needs of survivors of domestic violence?
Sure. So if somebody comes in and identifies as, you know, domestic violence, so part of our continuum includes our local domestic violence center, and so every day we're, you know, checking on that space, seeing if there's any vacancies, and, you know, besides that, we're also making sure that they call the domestic violence hotline. They have obviously a 24-hour hotline, and they're doing all of our safety plans. So when somebody comes in and identifies we're calling the domestic violence helpline, they are doing the safety plans for us, and then they're faxing over us a copy to give to the client. So they are definitely part of our continuum. We work with them every single day. They don't exclusively take from coordinated intake. We don't, you know, exclusively fill their vacancies because of the safety risks and, you know, numerous other factors, but we work with them every day.
Thank you. We have another question about diversion. What do you consider successful diversion, and how do you measure success in this program?
Well, what we establish is based on the families and individuals that we met with and assessed through a diversion process, that if we were able to successfully divert, 25 to 30% of those persons we met with, that would constitute success with respect to diversion. If those folks were able to remain out of shelter for a minimal of 45 or 60 days, but even up to a year, then that would be considered success. Now, in some cases, folks would get additional assistance through our continuum, but they may not need to necessarily re-enter shelter to get that help. They were already considered homeless, so we knew they were staying temporarily either with family or in other options. And it's from that place that we try to make every effort to assist that family to identify permanent housing so they wouldn't need to re-enter shelter.
Thank you. Who makes the decision about whether to move a family to the next more intensive intervention in the progressive engagement model? Is it the case manager working with them at the rapid rehousing program that makes that decision?
Well, actually what they do is the case managers right now, the way that we have it set up is that they recalculate their housing barrier score, and then we put together kind of an additional form that goes a little bit further into their barriers. Then they give that and review that over with their supervisor, and then their supervisor actually meets all the supervisors with the case managers, myself, central intake, and then the program manager for Zacchaeus. We go over then all of those clients. So there, it can range from people that have a really high barrier score to maybe more of a minimal, barrier score, but they have a high-risk pregnancy. And then so they're reviewed at that point to see, and then, do they have income? And so we kind of look into what their abilities are to maintain housing, what their barriers are as kind of, collaboratively, and then select those clients based off of that.
Can I just add something about that? Just kind of piggybacking off of Ann, it's definitely a community approach. And I know Ann said this earlier, but it is not a first come, first served basis. We literally take the housing barrier score and all those other things that Ann mentioned, and that highest need family is getting the first open slot. And so, every month we might be looking at 12 families, and those, and there might only be 5 spots. Those 5 spots are being given to the highest need families. And so it's just, and we do this, we meet once a month right now to go over, all the different families. So we can, we're making sure that the right level of intervention is given to the family that needs it most.
Yeah, and that's separate from the, meeting with the case managers, the rapid housing case managers twice a month. Because I think what we found was at one point we were having the rapid housing case managers kind of be more involved in it, but it became difficult, I think, for them to, it was almost like an advocate, fight over whose family needed it most. So it was better when it was, a little bit more of just on paper, these are the families, looking at things a little bit more clearly.
Thank you. This is a question about single adults. Do you know how that population is handled in your community?
Well, I mean, that could be a whole other webinar on how, what are the housing options for single adults. But in a nutshell, single adults are treated just like families when they come into coordinated intake. They get the same assessment. Layman and his team do the same, diversion sort of protocols with them. On our single men side, there are a lot of transitional housing options for single men. So what that means is a lot of our single men will go to the men's shelter and then get on a waiting list for one of the different transitional providers. And then after that, they'll get permanent housing. For single adults, it's a little bit differently. We do not have, we have one transitional housing program, which is that Laura's home that I mentioned, that's for families and single women. So they often they don't really have a lot of different housing options. Most of them either will be at the shelter to save up a first month's rent and security deposit, or they will get, some sort of permanent supportive housing because they have a mental health diagnosis, and they're disabled in some way. A lot of the singles have to be all of them have to be chronically homeless in order to access the permanent supportive housing options in Cleveland. Through Eden. So
Thank you. Well, it's just after 2 o'clock. We have a couple of other questions that we can follow up separately with those participants. I just wanted to thank all of our presenters today for the great presentation and information. We will be posting the webinar on our website either today or tomorrow along with the slides, and you can always follow up with me. I'm Jen Saunders, and my email will be posted if you have additional questions. And just to put in a plug for some upcoming webinars, we have another one coming up on April 27th on closing a case, and on May 10th we'll be looking at transforming the homeless system in West Virginia. So thank you so much to everyone.
Thank you.
Thank you.